let us discuss about the radius. It has upper end, shaft and lower end. Now when you take the radius, see for the two ends, the one which is rounded, it should be placed upwards, and near the upper end you see for the tuberosity, this is the radial tuberosity, and also just below that there is a sharp border is there. These two things should be placed medially, and see the come to the lower end and see for the tubercle. See, you can see that this is a tubercle, dorsal tube. This is placed posteriorly or dorsally. So these 3 points will help you to decide the side of the bone. So this is a left side bone. So head upwards, radial tuberosity and interosseous border should be placed medially, and the dorsal tubercle posteriorly. Now coming to the features, it has an upper end, shaft and lower end, right? So upper end has head, neck and tuberosity. So head, it articulates with the capitulum to form the elbow joint, superior surface, and its circumference articulates with the ulna to form the superior radioulnar joint. Now it has a neck and it has quadrate ligament is attached, and there is a tuberosity. To this biceps brachii is inserted. Now coming to the shaft, it has 3 borders: sharp medial border, anterior border and posterior border. Now these two like this, anterior, posterior and medial border. Now between these 3 we have surfaces are there: anterior surface, lateral surface and posterior surface. Now I would like to go along with the muscles only, like front of the forearm muscles you should remember, and back of the forearm muscles are also you should remember. Now this medial border continues down and it splits into 2, and between these 2 we have a notch called as a ulnar notch, this area. So now I would like to tell about the muscles. Now this is the anterior surface. So on this anterior surface, remember only 2 muscles here, that is flexor pollicis longus and in the upper part, and below pronator quadratus muscle. Similarly, on the posterior surface we have 2 muscles. Remember the 2 muscles. The 2 muscles are abductor pollicis longus and extensor pollicis brevis. These 2 muscles are extensor compartment muscles. Similarly, when you take the lateral surface, we have 2 muscles again, but these 2 muscles are coming from the, one is from the front, another is from the back. So we have in the upper 1/3 on the lateral surface, supinator muscle is inserted here. Similarly, if you take the middle 1/3 of the lateral surface, pronator teres is inserted. So one pronator teres is a flexor muscle, supinator is an extensor muscle. So you can remember this way. And anterior border has flexor dystoral superficialis muscle is attached here. Now this is about the in total about the shaft. You remember anterior surface 2 muscles, lateral surface 2 muscles, posterior surface 2 muscles. Now coming to the lower end, it is expanded, so it has an anterior surface, 5 surfaces: anterior, posterior, medial surface, lateral surface and inferior surface. Now you see there is a projection laterally from the lower end. This is a styloid process. Now coming to the anterior surface, just a ligament is attached because it forms a joint, wrist joint here. Now on the medial surface you are seeing this notch, ulnar notch. So ulna will be coming and lodging at this area, come close to this area, head of the ulna. If you take the posterior surface, you are seeing a tubercle here, Lister's tubercle. So lateral to the Lister's tubercle, we have 2 tendons. Now this is a posterior surface, so posterior muscles only remember, or extensor muscles you have to remember. Like extensor pollicis longus will be related here, and extensor carpi radialis longus will be related here, lateral to the tubercle. Now medially we have extensor dystorum and extensor indicis will be seen. This is on the posterior surface. Now coming to the lateral surface, there is 2 grooves are there here. for the abductor pollicis longus and extensor pollicis pleuris. You have to remember these two tendons are nothing but the muscles which are originated from the shaft or the posterior surface. Right? Now, there is a styloid process here. Here, brachioradialis is inserted. Brachioradialis. This is important muscle. You have to remember. Now, inferior surface, you are seeing this is an articular surface. It forms a wrist joint here. So this it has two parts. One is quadrangular area, another is a triangular area. So carpal bones, scaphoid bone and lunate bone are articulated here. On the medial side, you remember medial side lunate area is lunate bone is articulated. So on the lateral side we have scaphoid bone is articulated. So this is about the radius.